welcome again to Dr. SM Chirisa, and today I'm just bringing you this presentation right from my office, and I think it's going to help a lot of people. It's something that I've been practically seeing in my own practice, and I've seen it's so common and so rife, especially right now. And today we're going to be dealing with understanding insomnia. And insomnia is lack of sleep. So I want you right now to, if you're watching us on YouTube, please subscribe, like our page on Facebook, and call somebody to watch this, because I'm going to be telling you things that are going to help you. Even if you do not suffer from insomnia, I can bet you there's somebody in your family, among your friends, among your workmates, who's suffering from this. So let's start. What is insomnia? Insomnia simply means failing to sleep. It means difficulty in sleeping, difficulty in staying asleep, or waking up in the middle of the night while it's still dark and unable to get enough sleep. And it's very, very common. You're going to see as I go through that it's a common disorder, and it can occur at all ages, right from children to adults. But it's more right, especially with adults. And so when you wake up in the morning, you still feel tired. And a lot of people always ask me, how many hours should a person sleep? It is very important for you to understand that sleep requirements differ from person to person. But generally, what we know is that with kids, as you grow, as you go through the developmental life cycle, when you are a kid, you are sleeping 18 hours, you're sleeping 16 hours. And then when you get older, you sleep less hours. So as you get older, you will actually sleep less hours. But in general, for adults, you need at least 7 to 8 hours of sleep. If you're not getting 7 to 8 hours of sleep, you are suffering from insomnia. 7 to 8 hours of sleep. So what are the symptoms of insomnia? So like I said already, it includes the difficulty in falling asleep at night, waking up in the middle of the night, waking up too early in the morning, not feeling rested after a night's sleep, daytime tiredness. You feel tired during the day, you feel sleepy during the day, you are irritable, you're anxious, you are depressed during the day. Some people who are suffering from insomnia have got difficulty in concentrating, making decisions, difficult in paying attention. And some of the accidents that actually happen at work, road traffic accident, work accidents, these minor little accidents that happen is as a result of insomnia and ongoing worries about sleep. So a lot of people are complaining that a lot of people are complaining, I've not slept tonight. A lot of people said, this whole week I haven't slept. When you are complaining and you are worried and say, I want to sleep, but I can't sleep. When you are making those complaints, you know that those are the symptoms of insomnia, the lack of sleep. So what causes insomnia? Now, the causes of insomnia, there are so many. I cannot even finish in the time that I have with you this evening to list the causes. But generally, they are divided into two types of insomnia, two types of lack of sleep: primary insomnia and secondary insomnia. And today I'm going to focus more on the secondary insomnia. But what are primary? Now, what you need to understand that everybody in your brain, you've got what we call a biological clock or a circadian rhythm center, which controls your work and sleep pattern. And so I usually call it your biological clock or your sleep center. So you've got a sleep center in your brain which regulates when you sleep, when you wake up. That's why when you are used to wake up at 6, you wake up at 6 no matter where you are. Even if you want to sleep beyond 6, but at 6, boom, you wake up. Or if you want to sleep, especially with kids, you see them sleeping at 7. Even when they are watching anything, even they are doing something at 7, boom, they sleep. Why? Because their circadian rhythm, their sleep center is programmed. So all of us, we've got a center, we've got a part of our brain that controls our sleep. And so when you are suffering from primary sleep disorders, these sleep disorders have to do with your circadian rhythm or that sleep center. So it's a specific disability or a disorder that is affecting that part of the brain and you cannot sleep. However, most of the causes are secondary. As secondary, it means that you've got another condition, you've got another thing, but the primary manifestation of that thing is insomnia. For example, this week there's one gentleman that walked into my rooms and he was complaining, I've not been sleeping for the past 3 years. Then I realized, no. So I asked the questions that we ask a psychiatrist and as a sleep specialist. I then asked, okay, so what do you do? How do you, what's happening? Then I realized that this guy was actually suffering from generalized anxiety. So the problem was anxiety, but which was manifesting and presenting itself as insomnia. So what are the secondary causes of insomnia? Number one is stress. Stress is the biggest cause of insomnia. Lack of sleep, stress from work, stress from church, stress from school, stress from health, stress from finances, stress from family members, stress from children, that keep you awake all night, making you difficult in sleeping. Stressful events, traumatic events such as death of a loved one, illness of a loved one, divorce, job loss, car accident, exams, all those kind of things will produce stress which will keep you awake at night. Some people, what's the other cause is this travel and work schedule. When you change your work schedule and now you're working at night duty, and then the following day, the following week you're working day duty, then the following day you're working night duty. When it confuses your sleep pattern, so you will find that when you're at night duty, you're sleeping. Now your sleep pattern is used to try to sleep at night, and now you're back at that time. So you've got this confused. So those kind of reasons, it's better for people that work at night to continue to work at night. Those who work during the day to continue to work during the day. It's actually better for their sleep pattern, it's better for their body, and it's better for their health. Travel, when you travel through time zones and there's jet lag and all those kind of things, all those things will also produce insomnia, especially when you do that. Poor sleep habits. There are a lot of people who've got poor sleep habits, and when I say poor sleep habits, I mean people that sleep irregular times. Irregular bedtimes. Today they sleep at 8, tomorrow they sleep at 12, tomorrow they sleep at 2, then they'll try to sleep at 8. It confuses your brain. You confuse your sleep center and it manifests as insomnia. Continuously playing stimulating games, playing video games, playing always on WhatsApp, uncomfortable sleep environments. Your pillow is hard. The bed is pricking you at your back, and it's cold. Or it's too hot. All those uncomfortable sleeping environments will make you to suffer from insomnia. With TV, the blue screen, a lot of blue screen actually alters your sleep center, and you've got sleep problems. Eating too much late at night. A lot of people who eat huge meals late at night, it will bloat you, you'll have acid and all those kind of things, and it will wake you at night. The other thing which is very important, especially as a psychiatrist, is that there are mental disorders that actually present with sleep problems or with insomnia as part of their symptomatology. Not just insomnia, but as part of their symptomatology. For example, when you are anxious, most anxiety disorders will present with insomnia, lack of sleep, because you cannot close the windows of your mind to shut down like what a computer does. They are keeping open and they are resisting, and you stay awake the whole night. And what we have seen is that with anxiety, the insomnia is actually, we call it initial insomnia. It's insomnia that happens when you go to bed and you cannot fall asleep. So anxiety causes what we call initial insomnia. Depression is another mental disorder that causes insomnia. And so many people don't even know that they're depressed, but they're suffering from depression. And the presenting symptom would be lack of sleep. And with depression, we call it terminal insomnia. What happens is that you actually fall asleep. Then in the middle of the night, 2 o'clock, 3 o'clock, you wake up and you cannot fall asleep, and you are just thinking and ruminating, you are crying in the middle of the night. You know you've got depression. The other one that is very important, especially when it comes to insomnia, is bipolar. Now with bipolar, there's actually what is called reduced need to sleep. The person has got so much energy, so much zest, and they see no need to sleep. So they can go 1 day, 2 days, 3 days. I've seen people who have got active bipolar symptoms, and they can go for 7 days without sleeping, making noise during the night, writing, reading, crying, praying, and doing whatsoever. And it's actually a mental illness, and it needs to be treated. The other thing that I've seen that also causes insomnia is medication. Medication, yes, medication as a side effect. There are some medication that will cause insomnia or make you to fail to sleep. Some of the medication that I used for asthma, for blood pressure, even for anxiety, treatment can actually cause you not to sleep, especially if they are taken at the wrong time. And there are also some medication, especially slimming medication. A lot of ladies are taking a lot of slimming medication, and most of these slimming medications, they are caffeine based, and that caffeine it actually is a stimulant. It makes you to fail to sleep. A lot of weight loss tablets or medication are actually caffeine based. Help you to burn your fat, but then you don't sleep. The other thing are medical conditions. There are medical conditions, especially that are associated with pain. What I call chronic pain. When you've got pain in your body, a headache, or you've got arthritis, which is not treated. You've got ulcers, which are not treated. Those medical conditions, because of the pain, will keep you awake and disturb your sleep. Other medical conditions are heart diseases that are not well controlled. So you try to sleep and you feel out of breath. Asthma attacks that is not well controlled. Parkinson's disease, Alzheimer's disease. All these diseases are associated with insomnia. And then there are other things that are also associated: your caffeine, your nicotine, your alcohol. Especially a lot of people, they take alcohol to sleep. Now, the thing with alcohol, that alcohol, yes, it's a depressant. It will help you to fall asleep, but it prevents you from getting into deeper stages of sleep. Now, sleep has got 4 stages: stage 1, stage 2, stage 3, stage 4. I'm not going to go into that because I don't want to turn this into a scientific lecture. But those stages of sleep, your level of awakeness, your level of consciousness within that sleep stages is different. Now, with alcohol, you'll be able to fall asleep, but you will not go into deep stages of sleep. So when you wake up the following day, you feel as if you have not slept enough. And so alcohol is very difficult, it's very problematic, and it also causes evening, or you just wake up in the middle of the night. And so all those things are very important for you to look at, because they are causes of insomnia. And one of the biggest causes of insomnia is aging. Aging, as you age, as your age goes from one digit, 2 digit, 3 digit, there are problems that are aging is associated with insomnia. So a lot of elderly people, generally their sleep pattern, they start to sleep 4 hours, 3 hours, but they still need the 7-8 hours. They still need the 7-8 hours. But some of the biological clock is changing, and they've got other issues, medical issues. They are taking now medications. There are now chronic pains in their body. They've got so many problems that they are thinking about their children, their grandchildren, and all these kind of things will actually affect their sleep pattern as you age. So age, but generally as people age, the numbers of hours that they sleep naturally decreases. So, how do you prevent? I think it's very key for us to talk about how do we prevent insomnia? How do you prevent yourself from not being able to sleep? Because if you don't sleep, you predispose yourself to a lot of medical conditions, anxiety disorders, depression. You predispose yourselves to strokes. It has been seen, studies have shown that people that don't sleep, they are likely to have a stroke, a cardiovascular accident, a heart attack. People don't sleep, they increase chances of having conditions like cancer and all that, hypertension. So sleeping is so important for your general health, physically and mentally. It's very, very key. So how do you do that? And the first, we as psychiatrists, we don't just prescribe medication. We don't just heap medication on you. We look and say, what are your sleep habits? And what we usually call sleep hygiene. But a lot of people don't have good sleep habits or sleep hygiene. So we ask you, do you so number one, for you to sleep, keep your bedtime constant. If you decide to sleep at 10, start to sleep at 10. Even if you don't have hope, if you are not even feeling sleepy, go into the beds, shut down and sleep. And if you do that for enough time, usually 3 weeks or so, you start to realize that you change your sleep pattern, you change your sleep center that I talked about, your circadian rhythm will then adjust. But if you are changing, you are going to be in trouble. Also, maintain your awake time. When you wake up, maintain your wake time and be consistent. Day in, day out, including weekends. A lot of people say, no, during weekends, I want to do this, I want to do that. Stick to your bedtime and wake time. The other thing that you need to do for you to sleep well is to stay active. So when you exercise, when you tire your body, when you exert a lot of energy, when you do all those kind of things, it promotes good sleep at night. And a lot of people are not even exercising, they're not walking, they're not doing anything, they are doing less than 500 steps per day, they are not, and that affects their sleep time. Number 3, check the medications that you are taking. Some of the medication can actually affect your sleep time and contribute to insomnia. Also avoid and limit naps during the day. A lot of people, because they've got nothing to do, they just take naps, but those naps then disturb your sleep pattern, and when you want to sleep, it is already disturbed. So avoid a lot of naps or sleeping during the day just because you want to sleep. Avoid and limit taking caffeine, especially after 6 o'clock or after 8 o'clock at night when you want to go to sleep. Avoid caffeine, avoid alcohol, and also avoid and even do not use nicotine-based products. Avoid large meals when you want to go to sleep. A lot of people just eat and immediately they go to sleep, but it's going to affect how you're going to sleep. Avoid beverages, especially carbonated drinks, when just before you go to bed. If you want to drink something, just then take water. Also, make your bedroom and your place as comfortable as possible so that you create an environment that you are happy to go to. And we also say, do not use your bedroom for other things, for reading, Make it, just make sure that it's just for what a bed is made for, and sleeping and other things. All right, so you can also create a relaxing ritual around your sleep. A lot of people, they want to be coming from a high activity and immediately want to go and sleep. But your body does not work like that. It's like your mind does not work. So you need to do a shutdown, a progressive stage shutdown where you relax, where you calm yourself down. You might read, just a bit, play soft music, dim the lights, bring yourself down, and that's important for you to deal with insomnia. So what do we do when somebody comes to us and is suffering from insomnia? We have to make a diagnosis. So we do a physical examination, we look at the sleep habits, and sometimes if necessary, we have to do what are called sleep studies. One of the things that we have also seen, which is very common, that causes insomnia is what is called sleep apnea. Sleep apnea is when you sleep, you are so big or fat or obese that you block yourself, you cut your air off when you sleep, so you then have to wake up to save your life. And so you've got this multiple waking up, and this happens to people that are usually snoring, or you've got adenoids, or people that have got large tonsils and all those kind of things. So all those things need to be examined. And so how do you treat? Obviously, there are simple things that you can do without medication. So first of all, sleep hygiene. I've already told how you can do that. And a lot of people, they'll actually do well without medication, just sleep hygiene. A lot of people now, they are spending a lot of time watching, listening as they go to sleep, and that keeps them awake. You start watching a series at 12 o'clock, you're going to watch it until in the morning, So you better put your phone away. The blue light keeps you awake. So we call it stimulus control therapy. Control the things that are stimulating you and avoid all those things. The other things that you might also learn is what we call relaxing techniques. Ability to relax. A lot of people don't even know how to relax. They are still tense. So you can do muscle relaxation, breathing exercises. They reduce your anxiety. Just lying down, just focusing on nothing, just focusing on yourself and just sleep. You actually relax or smooth yourself with good music, a good bed, and all those kind of things. Sleep restriction. Avoid, sleeping during the day. Avoid the naps and you sleep during the time that you're supposed to sleep. Light therapy. Light is very important for you. So when during the day, always expose yourself to bright light. It actually helps with your sleep center for you to awake, and it controls your sleep clock. But we can also go beyond that, especially with a lot of people that will then need medication. So some of the medication that we prescribe for primary sleep disorders are what we call sleeping tablets. But people with depression, people with anxiety, people with bipolar, they don't need sleep medication. They need appropriate treatment for depression, appropriate treatment for anxiety, appropriate treatment for bipolar. If you treat the primary cause, you will treat the secondary presentation of insomnia. But there are quite a number of drugs that are there: benzoate, non-benzoate, benzodiazepine-based treatment. And so as doctors and as psychiatrists will be able to look at what is going on, what is needed, and give them appropriately. However, usually we do not give and we do not recommend sleeping medication for more than 2 to 3 weeks. But however, there's some people that you need to prescribe for life or for a longer time, depending with what will be going on. But it is important for you to get treatment. So at what point should you come to us, or should you look for a psychiatrist and say, look, I am suffering from insomnia? This is very common, and a lot of people don't even want to come to us because they think psychiatrists are only dealing with psychotic issues. But insomnia is in the realm of psychiatrists, and we are the best doctors to help you, because most of the things that cause insomnia, they're actually in the realm of psychiatry. So when you identify that you're not sleeping, when you identify that you are sleeping less than 6 to 7 hours a day, when you see that it's now prolonged, you're feeling tired, you're becoming grumpy, irritable, tired, performance is going down, that's the time you need to seek treatment.